on Not the Andrew Marr Show. We're joined once again by Dr. Bob Gill, and good to see you, Bob. How are you doing?
All good, Crispin. Thanks for inviting me on.
Well, look, I've got a bit of a task for you this time, Bob. I'm sorry to put you through it, but Wes Streeting's done a speech at the Labour conference, quite a long speech, not as long as Keir Starmer's, but quite long. And he's talking about the plans for the NHS. And I thought if we could go through the whole thing, not line for line, not every single line, but most of what he says, and I'll just play it and then you comment on it, then everyone can find out really what's going on, because I think this is the best way of doing it. So what I'm going to do is I'm just going to start off with a clip of what happens before Wes Streeting comes onto the stage, so you can understand the context of his speech. This is a delegate at the conference who's been asked to speak about the NHS. There's only one person, as far as I could tell from this debate, who's been asked to speak about the NHS, and this is this delegate.
Well, I'm an award-winning primary school music teacher. What about me? Perhaps I could rise to become a deputy or even a head teacher, or focus more on my music and make it on stage at Glastonbury. I could have a loving partner, a family of my own. Sadly not. Because I have stage 4 incurable bowel cancer, and in 5 years, it's all but certain that I will be dead. But if I'd been more aware of my cancer warning signs, perhaps I could have caught my metastatic disease at an earlier stage. And if the NHS had more capacity in the system for tests, scans, biopsies and treatment, my prognosis might not be quite as bleak. From GP contact to chemotherapy, just in time for my 37th birthday, I waited 15 weeks. This was all meant to happen within 62 days. Wes Streeting, my local MP, has been to war with cancer and come out the other side. People often wonder why I'm not tucked up in bed waiting to die. Well, I have an inspirational role model. Wes hasn't just chosen to live, but dedicated his life to public service. It's too late for me, but there's one person I trust to save and transform our NHS. Conference, I give you Wes Streeting, Labour's Shadow Health and Social Care Secretary. Thank you.
Nathaniel, it is truly an honour to have you with us here in Liverpool. When you came to see me in my advice surgery that Friday afternoon, I was moved by your spirit and your courage. Your determination to follow your great passions, music and education, in the face of your terrible diagnosis blew me away. I also felt a deep sense of injustice that I feel now. The injustice that the NHS didn't reach you in time. The injustice that delay meant the difference between life and death. As a cancer survivor, it shakes me to my core. I owe my life to the NHS because it was there for me when I needed it. And not many people find themselves in a position to repay that kind of debt to the NHS, but I can. And I am determined to make sure that the NHS doesn't fail people like Nathaniel anymore.
Bob, I thought that was a very dramatic way of introducing a speech. Someone who's going to die from cancer in the next 5 years, he said. and then who said that he's inspired by Wes Streeting and he thinks Wes Streeting's going to save the NHS. And then, as you saw, what do you make of that introduction?
Yeah, it's a shame that politicians are willing to use tragedies such as that poor teacher was describing, his personal tragedy in terms of delayed diagnosis, for political ends. Watching that, you feel sympathy for the speaker, but at the same time, I cannot shake this feeling that this is contrived. Certainly Wes Streeting's reaction to the story, and I felt that we are being emotionally manipulated, and that's not a good look for somebody trying to be serious about what he plans for the NHS should he get into power.
Yeah, I have to say I agree with what you're saying. I found it quite extraordinary, actually, that the way it was that he came on, and he's a safe pair of hands. Now this is that seemed to be what was trying to be presented there. He's a safe guy of the NHS, but this is what he says in his speech about his commitment to the NHS, and I'm interested to hear what you say, what you think about this.
Labour will never abandon the founding principles of the NHS as a publicly funded public service, free at the point of use.
Right. What does that mean? Can you tell us what is he saying exactly what the NHS is about? What's his definition there?
Well, he's left something extremely important out of the principles, and that is public provision. One of the key things that Bevan ensured was that those people providing the care, those people running the NHS, were public employees, and he did this to ensure quality, to ensure people were fully qualified and experienced enough to provide that care, and to ensure the people working in the NHS had control over how it's run. But New Labour in the early 2000s destroyed those principles of public provision and also removed the control of how the NHS was organised from the frontline clinicians and created this bloated bureaucracy. So what is very telling is what he's left out, but also, a publicly funded and free at the point of use could also apply to a privatized system. That's exactly what Medicare is in America. It's publicly funded through federal taxes, but it's increasingly private provided because the company that infested the NHS, United Health, is also taking an increasing part of the provision of Medicare. So Streeting's definition could apply to the American system as well.
Well, that's very interesting because everyone read that as he's not going to do anything damage our NHS. They're all standing up after that, giving him a big ovation.
Well, those people haven't spotted what he's left out, clearly. I went up to the conference. It was like a gated city. It was full of suits walking in and out of conference. There weren't many normal looking people there. This is a very staged, managed event. And I'm sure they screened anybody out of that conference who might oppose what Wes Streeting is saying.
Yeah. I mean, that the next clip is he's talking about how he's going to cut waiting lists. I'll just play this one as well.
Patients are left waiting. That's why a Labour government will take immediate action to cut waiting lists. We'll provide an extra £1.1 billion to help the NHS beat the backlog with extra clinics at evenings and weekends, providing 2 million more appointments each year. Faster treatment for patients, extra pay for staff, the first steps to cut the waiting list and beat the Tory backlog.
What did you catch from that? Because he says 2 million appointments each year. Now I'm thinking there's 60 million people in the country. That doesn't seem that many. What's your take on what he says in numbers there?
Well, we have this circle of problem, reaction, solution. This takes me back to the early 2000s, again, when the Conservative Party ran up the waiting list. Labour came in with their solutions. But what he's also said, in other speeches is that he wants to use the private sector, as has Keir Starmer. He goes out of his way to spell out who will be providing these extra appointments in the conference speech. So that is a concern. He's already spelt out he wants to use spare capacity, as they call it, in the private sector. So who's going to be providing this care? Where is the money going? How much money is going to be siphoned off in profit? And the number of new appointments, all of these appointments are welcome, but where are they happening and who's providing them? He's leaving out the key information.
Right. Yeah. Okay. Well, the next bit he talks about is the case for reforming the NHS.
I make the case for reform not in opposition to those principles, but in defence of them. I'm blunt about the fact that the NHS is no longer the envy of the world, not to undermine it, but to reassure people that we've noticed. I argue that our NHS must modernise or die, not as a threat, but a choice. The crisis really is that existential. When I look at leading health systems across the world, the fundamental problem with the NHS becomes obvious. We have an NHS that gets to people too late, a hospital-based system geared towards late diagnosis and treatment, delivering poorer outcomes at greater cost, an analogue system in a digital age, a sickness service, not a health service, with too many lives hampered by preventable illness and too many lives lost to the biggest killers. So be in no doubt about the scale of the challenge. Not just because as waiting lists rise, public confidence falls, but because in the longer term, the challenge of rising chronic disease, combined with our ageing society, threatens to bankrupt our NHS. The Tories' answer is all sticking plasters in the short term, but an abandonment of the NHS in the longer term. As we saw in Manchester last week, the Conservative Party dances to the tune of Nigel Farage now, and the more they move to the right, the greater their threat to our NHS becomes. So it falls to us, the party that founded the NHS 75 years ago, to rescue, rebuild and renew our health service today.
Now, can I just say with that one, I got a lot of fear from there. There's a lot of using fear. Nigel Farage is waiting to come in and privatise. That was one thing. The other one is said bankrupted. The NHS will be bankrupted unless we reform it. That's an obvious sales tactic of giving people fear and then giving them a solution. And everyone gets up on their feet to applaud him. What was your take on what he said there?
Yeah, he's like the doctor who can recognize the patient is sick, but offers the treatment that will kill the patient. The NHS, as we've discussed previously, has been reformed to death. We've had the financing using private finance initiative. We've had the marketisation. We've had the outsourcing. All of these reforms done by Labour and Conservative governments have caused the NHS to be in its current crisis. Now, he hasn't recognised any of those causes, but he's moving on to yet more of the same. And what he is signalling, in fact, is a continuation of the policy stream. It wouldn't matter if the Conservatives carried on in government. From what Wes Streeting is saying, there will be no meaningful change. The only thing they plan to continue is what the Conservatives have spelt out, which is opening more diagnostic centres in the community, which will be run by private companies, and more money will be siphoned away from patient care. That's what he's talking about. And, he paints the NHS as some sort of institution that can't be changed and, is analog, we're in the digital age, all this nonsense. But in fact, the medical profession and healthcare adapts all the time. We do not need politicians who run a parliamentary system, which is hundreds of years old, very undemocratic, telling the medical profession and healthcare they need to modernize. This is total nonsense. It's great sounding rhetoric, but actually all I see is a continuation of the Tory policies of privatization.
So that stuff about we're going to change the way we run things away from hospitals back to communities, that's exactly what the Tories are doing anyway.
Yeah, the Tories are stripping out diagnostic services out of the hospitals. They're guaranteed contracts to private providers. We have a burgeoning private health sector. We have a massive new hospital built in the central of London at a cost of £1 billion. So the private sector are smelling blood, and they're rubbing their hands together, because what Streeting and Labour are signalling is fill your boots, guys, because we're going to hand you more and more of NHS service provision.
Right, I see. Now this is an interesting one, because he actually, in the next clip, distinguishes Labour from the Conservatives.
Those are just the first steps of what is needed. Our reforms will be fundamental and deep. They have to be, if the NHS is to be there for us in the next 75 years, as it has been in the last 75 years. The choice at the general election is clear. We can see the future with the Tories unfolding before our eyes. A two-tier health service where those who can afford it go private and those who can't are left behind. Our NHS reduced to a poor service for poor people. Our country viewed as the sick man of Europe. Labour has a different vision for our future, where no one fears ill health or old age, where people have power, choice and control over their own health and care, where the place you're born or the wealth you're born into don't determine how long you'll live or how happy you'll be, where patients benefit from the brightest minds developing cutting-edge treatments, and where children born in Britain today become the healthiest generation that ever lived. That's Labour's ambition for our country.
Now, what struck me there was he says the Tories have a two-tier vision of the NHS, and Labour's is not like that at all, and he lists all those things about it. What do you make of that then?
Yeah, he's trying to echo language used by Bevan. It's very appealing to, the Labour stalwarts, but the reality is it's vacuous, because he hasn't identified what has already happened to the NHS, which was the legislation passed last year, Health and Social Care Act, which created these new public-private partnerships, integrated care systems, which will shrink NHS provision. Now, if he hasn't diagnosed that problem, how can he possibly be the person with the solution? So he doesn't actually put out that he understands what's happened to the NHS. So this is, I'm afraid, just designed to appeal to the audience, but it's vacuous, empty rhetoric.
Right. It sounds like he's making promises that are kind of over the top. Very, the health of the nation will never be better, and the poor people will have no fear about being treated. I mean, how can that be the case?
Well, yeah, that was the language of the post-war era before the NHS came about, when they were promising these reforms. But he hasn't outlined how he's going to undo the privatization. The word he's steadfastly avoided is renationalization. That's what we need. That's what the NHS needs, is to remove the market, remove the odious debt, and bring services in-house. But, I've been through his whole video. What he doesn't mention is the current strike action and recruitment and retention problem. That seems to have gone over his head. So again, it's like a doctor can't recognize a patient bleeding to death and is busy examining his toenails. He's completely off the mark.
Okay, well, the next bit he sort of picks up on is dentistry.
We've also got to deal with the immediate crisis in NHS dentistry. Do you know, things are so bad that the number one cause of hospital admissions among children is tooth decay. people are pulling their own teeth out with pliers because they can't get an NHS dentist. This is Dickensian, DIY dentistry in 21st century Britain. That's why Labour will deliver 700,000 extra appointments each year, get more dentists into the communities that need them most, and make sure that everyone who needs an NHS dentist gets one.
Is that another case of a promise that he can't actually deliver, or I mean, is that enough as well? I don't really understand the dentistry thing. Do you think he's got a point there?
Well, I think he's tapping into a widely held view amongst people that they can't access NHS dentistry. So he's pushing a very open door there. Whether his promises will deliver anything, time will tell. But, given that we have A&Es overrun with patients waiting for hours, ambulance stuck outside hospitals, people dying in corridors, my priority would not be NHS dentistry. He is putting the cart before the horse. He's dealing with minutiae and making promises they intend to keep whilst ignoring the big problem.
Another part of his speech, which is he goes into some detail on his use of technology and how that's going to change everything.
If we combine the care of the NHS with the ingenuity of our country's leading scientific minds, the NHS could once again be the envy of the world.
So technology for him is the breakthrough. I mean, when he talks about reform, he doesn't mention privatization at all in the speech. He mentions technology, AI, and stuff like that. That's where we're going to bring the NHS up to speed or whatever. What's your view on what he's saying there?
Yeah, so nobody can argue against using technological advancements, but everything I hear coming from them, I can also see how the private sector are going to cash up. So you've got big tech firms like Palantir, the spy tech agency has been awarded a no contest contract for dealing with patient data and records. We don't know how these commercial companies are going to be cashing up on using that data. It's not very clear how that will work out. You tend to feel that the taxpayer and the public are getting the raw end of the deal. We take all the risk, we're funding and giving away assets such as patient data, but what is the return for us? There's a lot of promise about use of technology, but when you look 5-10 years down the line, very often, more often than not, those promises aren't really realized, but you get a big tech company walking away with a handsome profit. So, it sounds appealing. Most people don't understand what the implications are. And there's also the threat, potentially, of the over-reliance on AI and the dehumanization of provision of healthcare, such as who decides on whether a patient gets treatment? Will it be the computer algorithm, or will it be a human consultant who can take all the factors into account and make a decision face-to-face with his patient? So there are risks innate in all of this, but one common theme is private companies will be cashing in.
Right, yeah, very good point. I mean, it could have a detrimental effect if people, if AI doesn't have the answers that he's trying to say it does. Now, another thing he says that there's stuff going on in the NHS that isn't being used enough. The NHS is already doing initiatives. People are working on initiatives in the NHS. This is something he says. I'll just play this one here.
There is nothing wrong with the NHS that can't be cured by what's right with the NHS. In Sussex, GPs work together, providing specialist and urgent care in the community, allowing patients to see their regular family doctor and giving them greater control over their own care. They're preventing 4,000 patients from having to go to hospital every year. Primary care will be at the heart of Labour's plan for the NHS. We'll train thousands more GPs, cut the red tape that ties up their time. Labour will bring back the family doctor.
That must be of interest to you. Is there anything else he's said in other areas about how he's going to achieve that, and what does that mean for you? What he's saying?
I've been in general practice long enough to remember what New Labour did to primary care. In 2004, it introduced a new contract which privatised out of hours. Yet here's Wes Streeting saying we want to bring your local GPs back into the provision. So this party is reinventing a wheel that it smashed 20 years ago. We've been here before. Consecutive parties have also done whatever they can to break continuity of care. We know that, this is good for patient outcomes. It's good for doctor satisfaction. New Labour, again in 2004, introduced a lot of targets, and payment was related to targets. This payment was conditional. So these are the very people who brought in a lot of this red tape, and now they're professing to know the solution. So, you couldn't make this stuff up. Yet there's no recognition that Labour made these mistakes when they were last in power. So I do not believe for 1 minute they have a solution that will restore continuity of care, that will restore autonomy to the general practitioner. You can recruit as much as you like. You're going to have a high turnover of workforce, a very dissatisfied workforce, and continuity obliterated.
And we've been covering the GP surgeries being bought up by these companies, and they've got dozens of GP surgeries. I mean, how does that fit in? He hasn't seemed to have spoken out against these companies taking over GP surgeries, has he?
Well, I don't recall him speaking out. Again, it was the Labour reforms that enabled that to happen. For the first time, you didn't have to be a doctor to run a general practice surgery. So that's when the companies started to creep in. And I suppose, it reached its highlight when Centene became the biggest provider of primary care in England. So that process was initiated under New Labour. Their track record speaks for itself. They've done exactly the opposite of what Wes Streeting is now promising to reverse.
So it does sound like bullshit.
Yeah, I wouldn't disagree with you. Very strong smell of bullshit to me.
Yeah. I mean, it's something that everyone would like, but it's just not. It's not what he's said anywhere else. Now the next clip is actually where this is the finale. This is the grand finale. He's laid out all these other tricks, these things that he said that we've all heard earlier on this discussion, and this is him ending it. So we've seen the start, how he did that. This is how he ends it. I'm interested to hear your thoughts on how he ends it.
At the general election, when they ask, why Labour? You tell them. 2 million more appointments a year to cut waiting lists, 700,000 more appointments with NHS dentists, mental health support in every school, mental health hubs in every community, double the number of scanners, the biggest expansion of NHS staff in history, more doctors, more nurses, more midwives, an NHS that's there for you when you need it, back on its feet and fit for the future. So let's go out there. Let's give Britain its hope back. Let's give Britain its NHS back. Together with Keir Starmer, let's get Britain its future back. That's what we'll do.
What do you reckon on that? Did that get you off your seat?
No, he was just repeating the crap we'd already heard. He fluffed his lines at the end. It doesn't fool me, I'm afraid. You could put any politician there. Their scripts are written by the cheerleaders for privatization, the big four accountancy firms, the management consultants. So these people, these puppets are interchangeable. And what we've seen from start to finish is a performance which will appeal to the people who lack the knowledge and the history of what New Labour and the Tories have done to the NHS. And they're promising a lot behind the NHS logo, but the delivery will be privatized and profit will be extracted. And we will have a two-tier system, despite what Wes Streeting is saying in his speech.
So he's got loads of good reviews for it, saying how powerful and impressive he is. But you're not buying it at all.
His performance was good, but that's all it was. It was a vacuous performance, not spelling out what the NHS needs, which is to stop the hemorrhage of staff, to settle the pay dispute, and to renationalise the NHS. If I'd heard that, I would have been a very happy man. I didn't hear any of those things.